This is a very common scenario. What I would do is obviously take a full history examination, find out what the patient's desires are, find out the previous information about their surgery, do a full examination. We may need to do some investigations in the form of a possible ultrasound or an MRI scan. If the patient is happy with the size, shape of their implants, and on an ultrasound there's no evidence of a rupture, I would counsel them to leave well alone. In a situation where a patient's asking for removal of the implants, then obviously I'd counsel them very carefully that they need to consider what the potential aesthetic effects will be with the removal of the weight and the volume of the implant, and the potential side effects, for example, excess skin and droop of the breasts. Medicare has recently changed the rules as to what is and isn't covered by Medicare. Breast implant removal for complications is covered by Medicare. Removal and replacement in most patients would not be covered by Medicare, and in the situation where a replacement is performed, the removal then is not covered by Medicare. Classically, to be covered, the patient will need to show that on table there's a real concavity after the breast implants are removed. Now obviously it's impossible to predict that prior to surgery, so patients would need to go into the surgery assuming that it's not covered by Medicare and or private health funds, and therefore they would be not eligible for rebates, and in addition the surgery would attract GST as a cosmetic procedure, which means it's more expensive. In older patients, or any patients having breast implant surgery, they always need to consider that they're not lifelong devices. Even though these devices are much better than previously, they may have a limited lifespan. And any patient of any age embarking on surgery always needs to consider the potential for having surgery in the future, removal, replacement, adjustment of the implants. Now obviously in patients with increasing age, you've got to consider, in 10 or 15 years' time, you're going to be 10 or 15 years older. The potential of having another anaesthetic, you need to weigh up, the merits of the breast implant replacement against the potential risks of having an anaesthetic when you're older. It has been shown in recent studies that general anaesthetics are not as well tolerated as we thought in an older population. It is associated with short-term memory loss for up to 3 months in older patients, and there is some emerging evidence that there may be a slightly higher risk of dementia in patients of extreme age as well. So again, patients are counselled about all these things, and they need to look at the whole picture and work out what's the appropriate thing for them and their particular situation.